Welcome to Ask the Expert, North Texas, here on News Radio 1080 KRLD. I'm David Rancken.
And I'm Kristin Diaz. Alrighty, so today is a gorgeous day. And, we're in springtime now. So one day we have beautiful weather. The next day we're on severe weather alert. But on those days, whether it's sunny or not, you've got to protect your skin. Did you guys know that May is Melanoma and Skin Cancer Awareness Month? And as we continue into this new month, we have Dr. Katherine Wang, who is joining us. She's an oncologist with the medical staff at Texas Health Presbyterian Hospital in Dallas. And she's going to be joining us to talk more about melanoma. And Dr. Wang, I feel like personally, when I hear about melanoma scares, it's always from like celebrities and something that goes on the headlines and seems like somebody gets they had it on their face or they didn't realize it was such a big deal. They get it taken care of and then we never really hear about it again. But melanoma is pretty common, isn't it?
It is. It is. Actually, I can tell you, actually, the skin cancer is the most common cancer in U.S. And melanoma, although melanoma is only consists of 1% of all skin cancer, melanoma is the most dangerous type of skin cancer because it has a tendency to spread to other parts of the body. So when it spread to other part of the body, it's dangerous. Obviously, it's advanced stage and the treatment can be very limited. So really early detection and prevention is the key.
Do people just not take the whole concept of skin cancer seriously?
Yeah, I think, probably a lot of people just because of misconcept, because skin cancer is a wide variety, right? There's squamous cells, the basal cells. Those are a lot less invasive. They don't usually spread. But melanoma, it's only, like I said, 1% of the skin cancer. So sometimes I guess patients just, people get ignored because of that.
Dr. Wang, I know when I was a little girl, my mom was really big about skincare. And at a young age, she was always on me about wearing, sunscreen on my face. And so that has been a regimen I've been doing since I was a preteen. But sometimes I think about, maybe it's not just your face that you need to protect. You have so much skin. It's your whole body,
Mm-hmm.
How should anyone, whether they're, particular about staying in a regimen to protect their skin or not, how should we take care of our skin on the daily and as far as also screening ourselves?
Yeah. That's a great question. So, I think let's talk about, first of all, the single most important risk factor for skin cancer, especially melanoma, is UV light. So that includes sun exposure and including indoor, like tanning boots. So those are most preventable risk factors for someone. So in order to significantly reduce the risk of melanoma or other skin cancer, you really just need to protect your skin. Basically trying to avoid those overexposure of sunlight, and limit tan booth, not going in tanning baths. And then, the sunburn is also very, very bad for your skin, any age. The risk for UV light exposure really grows with the amount of what your lifetime accumulation of UV light exposure. So you really have to start early. When you're a kid, teenager, you should start wearing sunscreens. We recommend SPF at least 30 or plus sunscreens. And sunscreen, also remember, you need to reapply it pretty much every 2 hours. This is very important. And then, obviously your face, and then for other places you wear hat. Some people actually develop melanoma within their scalp. So if you don't wear scalp, sometimes I have patients actually their hairdresser found their melanoma when they have haircut and say, oh, by the way, you have this mole or something needs to be checked out. So it's critical to wear hats and, white rim hat. For the body, wear long sleeve shirts, short and long sleeve pants, and then trying to avoid, the hottest sun, the weather between anywhere from 10 to 2 o'clock, and try and stay under the shade. So those are all very important. This is probably the most important thing that you can do for your health to significantly reduce the risk of skin cancer, especially melanoma.
And a lot of people do make the mistake of thinking that going outside on a cloudy day means, hey, there's no risk to my skin.
Yeah, exactly. So even in the cloudy days, you actually still get a lot of UV light. So, I mean, study has shown, so even with a cloudy day, you should have the habit to always apply sunscreens.
Curious about when someone should start seeing a dermatologist. I hate to say it, but sometimes seeing a dermatologist is seen as a privilege because it's
Yeah.
not your everyday doctor, it's a specialist, And so at what point should we start considering putting in that cost to go see a dermatologist regularly?
I would say everybody. I would recommend everybody go to see a dermatologist at least once a year for general population. So, but you can start with your self skin examination. There's a handy like a ABCDE acronym. It's very easy for everybody to examine your skin from head to toe. I would recommend at a very kind of a schedule like once a month or any kind of a interval is good, it's better for nothing. So ABCDE stands for A for asymmetric. So any moles have asymmetric shape. That's number one. B, we call the border, like irregular border. C called uneven color. D is diameter. So anything larger than a pea size, like 6 millimeter. And E means evolving shape or evolving color. So if you have any of those, like you have a mole started changing color or started growing bigger, or especially something like any new growth or non-healing, even if this looks like a bug bite, but it's not healing, those are very abnormal, then you should really seek dermatologists. But you should just definitely examine your skins, quite often. I would say recommend every month.
But again, aren't sometimes moles just moles and they're not necessarily skin cancers? We don't want to necessarily worry somebody that one new growth, oh, I've got melanoma.
Yeah, I mean, growth, a lot of people, especially for fair skin. So I think the genetic background also plays a very important role. So especially for some people, fair skin, light color, you can see, and for a blue color eyes, those are kind of a predisposed genetic background. Or if you have a lot of moles, yes, people can have moles, have freckles, moles, but unfortunately, those are actually already risk factor for developing melanoma. So, or if you were born with a large atypical moles, so those are things that you should watch. And personal history. Now, if you already had a history of skin cancer, squamous cells, basal cells, or a history of melanoma, then those are the people, usually dermatologists, say you need to come back to see me like every 3 months, every 6 months, because you could develop another melanoma. And sometimes family history plays a small role as well.
Curious about, okay, so what if you have one of those moles that are abnormal? What happens? Is it just cut out? When we think of cancer, sometimes we think the extreme chemotherapy, radiation, hair loss for somebody who's going through treatment. What does the treatment look like for someone who might have melanoma?
Yeah, I mean, this is, luckily, like I said, the skin cancer or melanoma is the most common cancer diagnosed in US, but luckily the majority of the skin cancer are early stage, including melanoma. It's probably the one of the most preventable cancer. So if you pay attention to your skin, if you get changing moles, go see a dermatologist right away. Oftentimes, those we call atypical nevi or atypical moles can be just resected. So remove it and it's cured. So luckily the majority of the melanoma is we call the preventable or early stage. Once you get resected, it's cured.
Within the last week or so, Moderna has come out with information about an experimental vaccine that can be used to treat it. Tell me a little bit about that.
Yeah, I mean, I think it's very exciting. Immunology or immunotherapy is really one of the most important breakthrough, I think, for the century in the cancer therapy. Initially, back in 2011, the first immunotherapy agent called Uvoid was approved for the treatment for late-stage melanoma. And since then, there's many more immunotherapy agent approved for late-stage melanoma. Now, the trial alluded to is a melanoma vaccine So what they did is in a small study in the vaccine in combination with the immunotherapy called the Keytruda. So two agents combined together, they can actually enhance the immune system, people's immune system, allow them to recognize the melanoma cells more effectively and they kill the melanoma cells. So what the study has shown is they give this combination vaccine with the immunotherapy together. They noticed a significant reduction for patients already had a high-risk melanoma that was being treated. So it's very exciting. So I think immunotherapy, the agents, basically it works to wake up people's immune system to allow the immune system to recognize the tumor cells. The melanoma cells is almost kind of like a double agent in your body. It was your own cells, but it's mutated. So it sends out this false signal to tell the body, I'm not harmful, I'm part of the body.
Yeah.
But those immunotherapies actually can intercept those false signals and educate our own immune cells to attack, to identify those cancer cells, so to kill them effectively.
Wow.
And I mean, another dramatic, improvement for those immunotherapies, they can provide a very significant high response to killing the tumor cells and for years. So I have patients had immunotherapy and alive for many years, even though they have melanoma spread to their organs like liver,
Wow.
brain. So if you guys recall, one of the high profile example is our former President Jimmy Carter.
Wow.
He was diagnosed with metastatic melanoma to the liver and brain in August 2015. And he got immunotherapy, it's called the Keytruda. So after less than 6 months of therapy, his brain is clear. The melanoma cells, disappeared. So, those are real. Really, I had many patients, similar stories, and brain metastases, and are now free of disease for more than 5-8 years.
Wow, that is incredible.
Mm-hmm.
My last question to you is, we've talked about kind of like the involuntary exposure. I mean, whether you want to or not, you're going to be out and you're going to get hit by UV rays just because of the sun. But voluntary exposure, like getting your nails done, that has been also something that a lot of health experts have been warning about, is that women who go to the nail salon and use the UV light every week, every other week, we've seen some melanoma cases from that. Yes.
I mean, basically the study shows that UV light is basically dangerous to our skin. So I would say trying to avoid any excessive UV light exposure. That's basically period.
And my last question is, I've talked to other dermatologists before, and they have told me this, and the message really cannot get out there enough. A suntan is basically skin damage, isn't it?
Oh, yes, definitely. No question about it. The suntan, basically you are just pulling a lot of UV light to your skin, which is, no benefit at all. So we always say, don't go to the suntan, don't go to the, tanning booths. So this is studies, science evidence has support that this is UV light harmful to your skin, definitely associated with increased risk of melanoma and other skin cancer as well.
Really, really fascinating. That is Dr. Katherine Wang, oncologist on the medical staff at the Texas Health Presbyterian Hospital in Dallas, for letting us know more about Melanoma Skin Cancer Awareness Month. We appreciate you. Thank you so much for your time.
Thank you. Thank you so much for inviting me in the program, and hopefully we can raise some awareness in the society.
Absolutely. You got it.